highlighting 5 issues where the scheme is very different. And now maybe well, there are others, but I'm focusing only on 5. First issue is that this is a scheme where we are giving the choice to the people. So far, if you look at our investment, and we invest a large amount of money, more than about 125 lakh crores in the health sector through public sources, largely throughout. Earlier it was actually almost 100%, now maybe more than 90-95% is through supply side financing. We are supporting hospitals, we are trying to improve health services, and when we improve health services, we assume that once the services are there, everyone, and especially the poor people, are going to get services automatically. But if you look at the pattern of use right now, that assumption doesn't seem to be correct. If you look at public hospitals, in fact, the use of services by top 40% is about 50% more as compared to bottom 20%. So there is a inequity. That supply side, if you put 100 rupees there, only I think about 5 to 10 rupees go to the bottom 50%, bottom 20%, and remaining is captured by other groups. In the private sector, of course, things are even more inequitable. A private sector, of course, is based on profit motive in most cases. Of course, there are not for profit private sector too. This is a scheme where we are mandating that this money will go to only that service use which is done by this bottom 40%. So we are providing resources, releasing resources, paying providers only when conditional on when service is used by bottom 40%. And this bottom 40% or our beneficiary group has a choice of going to either public sector or private sector. Within private sector to anyone which is empaneled, there is no bar. So in that sense, we have actually totally disrupted the funding pattern. Earlier the funding was going to strengthen services, power was with the service provider, they had to decide who, or they could decide who to provide services to. Here the money is going only through the use of services by the bottom 40%, and it is also going to the private sector. So it's a totally different pattern of funding. It helps in terms of bringing all the states together. It helps in terms of providing services for the mobile population at the same rate, and it helps in terms of bringing more standardization of services across the country. And right now there is a huge variance, not only between different socio-economic status, socio-economic levels, but also across states. And this scheme is going to help in terms of bridging that gap by helping those states which are behind to catch up with those states who are ahead in terms of providing quality health services.